Good evening, everyone. I hope everyone is enjoying themselves in good cheer for this incredibly worthy cause. As you just heard, my name is John Chabot, and I'm here to say a few words about tonight's honoree, Angela Heller. Before doing that, I want to congratulate Centers Healthcare for the foresight, the insight to establish this award and to clearly identify one of the most amazing social workers in this city, Angela Heller. So they created the award right, and they chose the right judges this year. Thank you. Center Healthcare's website, I think, describes the genesis and the motivation for this award far better than I can. And it's actually on the inside cover of the program tonight. So I'm just going to read from that for a moment. Social workers are some of the unsung heroes of healthcare, the caring, compassionate patient advocates who every day keep potentially tragic outcomes from becoming commonplace. And the very fact that they can be described as unsung heroes is in itself tragic. Centers Healthcare knows just how critical the role of the social worker is to the quality of healthcare in the United States. In particular, we see how vital the social worker is to the elderly and underserved, and I'm going to add here the cancer patient, the most vulnerable members of society at one of the most vulnerable times in their lives, and we're doing something to recognize them. So, a huge thank you and a huge applause for Centers Healthcare for creating this. Now, you might ask yourselves, why is a pancreatic surgeon introducing the 2017 Centers Healthcare Patient Advocacy Awardee? Well, a decade ago, I decided that just operating on people with pancreatic cancer was nowhere near enough, so we created the Pancreas Center at Columbia University Medical Center. We're a group dedicated to caring for people with pancreatic disease in all of its manifestations, but of course, the worst and most common of those is pancreatic cancer. The center is founded on the principle that pancreatic cancer requires a collection of highly skilled and highly coordinated professionals to care for the entire person as well as their loved ones as they're going through these illnesses. We now see, as a center, about 1% of people who develop pancreatic cancer in this country. So having now cared for thousands and thousands of people with pancreatic cancer, I've learned a few things. Pancreatic cancer creates a huge range of human emotional responses. Those include fear, resignation, anger, depression, guilt, and when we actually are able to save people, even sometimes survivor's remorse. It truly takes a village to care for all of the physical manifestation of these diseases, as well as the psychological manifestations of these diseases. And Angie is one of the pillars of the village that we've created. She understands all those complex emotions that come roaring to the surface when people get a devastating diagnosis, or when they're actively coping with their disease, or even when we think they might be cured of their disease. She knows how to soothe anger and fear, sometimes without even speaking. She can hug you with a simple look. She usually brightens the room when she walks into the room, but instinctively knows when to shift and leave it somber. She brings out the best in everyone, patients, family, and staff. To all of us at the Pancreas Center, Angie is no unsung hero. She delivers some of the most potent therapies that we know: hope, compassion, and deep care. it is with great humility that I have the honor of introducing such an amazing person to you. I'm going to end a little schmaltzy. I'd like to leave you with a puzzle that I've been unable to solve as I've thought about this for the last couple of days. Angie's real name is Angela. So do you think that Angela's parents named her after an angel, and as a result she became one? Or do you think they somehow knew in advance that she would naturally be an angel to her patients?
Either side. This is move over to this side. Awesome.